Good day, ma'am. I'm Jan Tulakyal, second year nursing student from Pamantasan ng Lungsod ng Marikina, and I'm going to perform intrapartum newborn care or essential newborn care. Why it is necessary? Because we nurses are the one who takes care from infant to adult, and also essential newborn care prevent mortality of the baby. Then the first thing I'm going to do is I'm going to you're going to remove all your jewelries, and then you're going to perform hand hygiene. So I'm going to prevent contamination and then reducing the transmitting microorganisms. And then next is I'm going to provide for the client's privacy by closing all the doors and the curtains, and then let the mother position appropriate to delivering while delivering the baby, and let the client position comfortability. And then next is I'm going to gather all of my equipments, which is the two blanket, the bonnet, improvised bonnet. I don't have any bonnet. And then three sets of surgical gloves, but in my case I only have one surgical gloves, so let's just pretend that there's three. And then the improvised surgical clamp, sip it, and then improvised plastic clamp, sip it again, and then improvised surgical scissor. And then next is I'm going to position the clients appropriate to the position when delivering a baby. And then next is I'm going to use or to wear the gloves. Yeah. After wearing the first set of gloves, and then after delivering the baby, or after in the 3 minutes of the procedure, you're going to call out for the delivering time and date of the baby, and then also the gender of the baby. And then next is I'm going to get the blanket, the dry blanket. You're going to let the baby, you're going to dry the baby from the face to the upper extremity into the lower extremity while assessing the baby's breathing. After drying the baby, you're going to remove the wet blanket, discard the wet blanket, and then I'm going to initiate a skin to skin contact from the mother and to the baby. Initiating skin to skin contact is you're going to place the baby into the abdomen of the mother, or into the middle part of the breast of the mother, positioning the baby into a prone position. Yeah. And then next is you're going to get the bonnet. Then you're going to put the bonnet into the head of the baby. after putting the cord in the cord or in the bonnet into the head of the baby, you're going to remove the first set of the surgical gloves. Imagine that I remove it and then I wear a new surgical gloves because I only have one surgical gloves pa. And then you're going to change your surgical gloves in because you're going to hold the umbilical cord. And you're going to locate for the umbilical cord. And after locating the umbilical cord of the baby, you're going to get the first clamp, which is the plastic clamp. You're going to clamp it. Going to clamp the plastic clamp 2 centimeter before the umbilicus. And 2 centimeter before umbilicus. Okay. I forgot you before. Do not cut the umbilical cord immediately, but you need to wait and or let the pulsation to stop before clamping the first clamp. Okay, you're going to wait for the pulsation to stop, and then you're going to clamp the plastic clamp into 2 centimeter before the umbilicus of the baby, and then get the second clamp, which is the surgical clamp, and then you're going to clamp it into 5 centimeter before the umbilicus of the baby. Okay. Then next is you're going to get the surgical scissor. So you're going to cut the umbilical cord near to the plastic clamp. Yan. After cutting it, wait for the pulsation to stop, because this will prevent anemia to the baby, or this will protect the baby from intraventricular hemorrhage. Then after cutting the cord, you're going to get a intramuscular 10 IU of oxytocin. And imagine that this is a 10 IU of oxytocin intramuscular. And this oxytocin prevent from the mother to uterine atony. You're going to inject the oxytocin to the shoulder of the mother. Imagine that I already inject it because I just only have a improvised mother. Okay? And then after injecting it, I'm going to observe for the mother's condition, and then wait for the delivery of the placenta. After the delivery of the placenta, I'm going to check for the mother's perineum. I'm going to check I'm going to check for the bleeding of the perineum, if there's any tears or any problem in her perineum. And then remember that you need to maintain the skin to skin contact after all throughout the procedure. And then next is you're going to apply the ointment. You're going to apply eye ointment, and intramuscular vitamin K and hepatitis B vaccine. And imagine that this is again the hepatitis B vaccine. You're going to inject in the leg part of the baby, also the vitamin K, and then the eye ointment, syempre sa eye. Going to put the eye ointment into the eye of the baby, and then the next thing you're going to do is you're going to clean the mother. You're going to clean the mother, and then still you need to maintain the skin to skin contact, And then one thing that you need to note is do not do not batting of baby. Do not do not bat the baby. Do not wag mo munang paliguan ng baby after 6 hours after the delivery of the baby. And then you're going to clean the mother with the blood, and then you're going to again you're going to remove your gloves, and then you're going to discard, and then you're going to again the perform hand hygiene, and then observe infection controls, and then you're going to document all the necessary data or the necessary or any of the data, and then that's all. Thank you.